Hey, Brandon.
Hey, how's it going?
Good. How are you?
I'm doing well. How are you doing?
Good. Good. How's life in Dallas?
It's good. It's hot and kind of boring. We're all stuck inside still, so it's been good.
Good. I see you're in the office.
Yep, just did a half day today on Wednesday, and so just finished up some notes, things like that. So
Okay. Well, you got a good following here. People are um, saying hello, and you need to wave back to them. Fantastic. So I'm going to go ahead and get started. So currently you're in practice at Platinum Derm. So tell us a little bit about your practice in dermatology and how you got there.
yeah, so I joined this practice about a little over a year ago. Originally grew up in Oklahoma, did medical school at University of Oklahoma, and then actually went out to Vanderbilt in Nashville for dermatology residency, finished that up, and then was looking to come back in this area and found this practice with Dr. Crawford and Dr. Sklar and a lot of good partners here, and we have a pretty well established practice, so it was a good fit, and I've been loving it ever since. So it's been really nice.
Oh, fantastic. And you've made a nice name for yourself, great credibility and well liked by your colleagues and patients. So congratulations.
Well, thank you. Thank you.
Yeah, that's tough to do. Um, so, so we're gonna, really, kind of jump into it. You're a handsome guy. What do you like to recommend for men and aesthetics? What are the things that you're seeing, the trends in the market, and what are you doing for your patients?
Yeah, so men are always a tricky aesthetic field to get into because it's a lot different than female patients. The anatomy is a lot different. And if you don't really understand the anatomical difference between, the female facial anatomy and the male facial anatomy, you can get into some trouble pretty quickly. So most guys, the biggest reasons they come in are either receding hairline, or they complain of looking tired, which is typically areas around the eyes, or jawline. And those are what we see are kind of the three biggest cosmetic concerns in the male patient.
Okay.
And then recently, over the last 10 years or so, body contouring has started to become more popular and more of a target for the male audience as well.
Okay. So let's start. Let's start with the hair. So what are you doing there for men?
Yeah, so for men, it's mostly genetics and hormones that play the biggest part in receding hairline and hair loss. So it's mostly the testosterone that affects the hair follicles and leads to that male pattern hair loss. So recently, we've really started doing a lot of PRP, or something called platelet-rich plasma. And that's kind of been a big staple in my practice, especially this year. And what it is we draw your blood, kind of spin it down and remove some growth factors off the top layer of your serum. And then we actually inject that in the areas of hair loss. And that does a few things. That stimulates new blood supply to the scalp, stimulates new hair follicles, and can really help a lot of patients. And where we've traditionally only used it for, the male or female pattern hair loss, we're now also looking into it for things like alopecia areata, which is a immune-driven hair loss, and some other scarring hair losses to see if it can be beneficial for those patients as well.
So when you draw the blood, how long does that take?
Drawing the blood's normally fairly quick. It's just like a blood draw that you get, for basic labs with your yearly skin exam.
Okay.
We draw two separate amounts. If we're just doing hair loss, we draw a larger tube, which is 22 milliliters. So it takes about 5 minutes. And then to spin it down, it normally takes about 10 minutes or so. And so the whole process, including the injections, takes about 30 minutes from start to finish. So it's fairly
So
quick.
spinning down takes how long? It's
Normally about 10 minutes to spin it down.
spinning down. Okay.
And then
So
we
you're
draw.
using your own blood sterile technique, and it's pretty quick. So how many injections do they get?
It depends. Every patient produces a little varying amounts of PRP. And it depends on how hydrated they are, what their diet's been like, things like that. So if they're pretty well hydrated, you can normally get about 12 cc's of platelet-rich plasma. So anywhere from 15 to 25 injections across the scalp.
15 to 25?
Yeah,
okay.
yeah.
And how often do you repeat that?
So everyone has a little different regimen. The regimen that I do 4 injections, and I do them a month apart. So that's the initial kind of building phase. And then I start spacing things out depending on how the patient's doing. So if the patient's doing really well, then I'll go to every 6 months for a time or two, and then back off to every year, and then hopefully just continue them on their topicals. If they need a little boost, sometimes I'll keep it at 3 months for a few injections until they get where they want to be.
And when do you expect to see results?
I tell patients about a month after that 4th injection. Hair cycle is about 16 weeks, and it normally takes 4 or 5 hair cycles before you start seeing a lot of benefit from these injections. But everyone varies, a little bit within that window as well. I've had some patients after their 2nd injection have a great response. Some patients are a little slower, and it's 6-7 months afterwards. But it always varies a little bit. I tell them about 4 or 5 months after we start the process.
Right. So Nita asks, can this help women to get more volume in their hair?
It can. A lot of women that I treat with PRP, they notice because you develop more follicles, so you get a little bit more fullness, and then you're also increasing the blood supply to the scalp, and so that nourishment to the scalp, the hairs actually become a little thicker and a little healthier as well. So some women see a little improvement in hair texture, hair quality, and then also hair thickness.
So you come in, you draw 22 cc's, which is a little less than a tablespoon of blood, spin it down, 30-minute procedure, and you draw that every time. So once a month you come in and have that drawn. And I imagine pretty low side effect or none, really.
Yeah, it's really safe because we're using the patient's own blood and plasma. So there's no risk of allergic reactions to it. You do have a little bit of discomfort with the injections, occasionally a little bit of bruising. And then a majority of patients feel a little tight afterwards just because we're adding some volume. So you can have some mild headaches afterwards, but that's really the worst of the side effects.
And what percentage of men respond to this?
In my practice, I do as much as I can along with PRP to get the best results possible. So I normally add, I do a combination of topical Rogaine and Finasteride along with Ketoconazole shampoo. And then, if they need vitamin D supplements or zinc supplements, I add those. Because hair is just a difficult problem to deal with. And so the more that you are treating and the more treatments that you're throwing at it, the better off that you're doing. So I feel probably about 80 to 90% of my patients have some improvement. How much that improvement is always varies. Some have dramatic improvements, some have mild improvements, but majority will notice some difference if they're sticking with the regimen, they're sticking with their topicals, and kind of following our plan that we lay out for them.
Okay. So Finasteride is Propecia, 1 milligram a day. Is that?
So I will sometimes do the oral Finasteride, but more often I do topical. I get a mixture made of topical minoxidil, which is Rogaine. So I do a 7%, a little stronger than what you get over the counter. And then that's mixed with a topical Finasteride instead of oral Finasteride. Just because a lot of, especially younger males, tend to want to avoid oral Finasteride just because there's a very small risk of sexual side effects with it. So I try to block as much of that testosterone and hormone interaction with topicals if I can.
Right. So, and is this this concoction? What does that cost? The Rogaine finasteride topical concoction.
Made by a local compounding pharmacy here in Dallas, and it's about $45 for a bottle. The bottle,
$45.
yeah, the bottle lasts most patients almost 2 months.
Okay.
So it's pretty comparable to over-the-counter Rogaine. It's not bad.
Right. Right. Yeah. Plus, you're getting a medication and avoiding side effects. Okay. Great. Ketoconazole shampoo. How often do you use that?
Normally have patients use about 2 to 3 times a week. If you use it a little more than that, it'll dry the hair out. So I have them really focus it on the scalp, not wash the hair as much. And that does a few things. A lot of times patients will have a little bit of seborrheic dermatitis, which is some scaling and inflammation of the scalp. So it'll help control that inflammation. But it also has a little bit of anti-hormonal effects as well, and may add a little bit to blocking that hormone interaction.
Okay. All right. And what is is that over the counter as well?
There's a Nizoral is the over-the-counter form of it, which is the 1%. The 2% is prescription, and it's normally covered by insurance, anywhere from like $10 to $12. So it's really cheap.
Okay. Okay. And then you said zinc.
Yeah. I normally check labs when patients come in with hair loss just to make sure we're not missing anything. In women, iron's obviously important. And then vitamin D, and then males, vitamin D and zinc can play a role in hair loss. So I normally check those in basic labs to make sure we're not missing anything.
So you check zinc levels too?
Yeah, yeah.
Okay.
In males, I do. Not as much in females.
Okay.
Females, it tends to be iron deficiency is the driving cause more than zinc deficiency.
So iron deficiency leads to hair thinning in women?
Yeah, yeah. Iron deficiency, vitamin D deficiency can sometimes contribute as well. But the majority of, especially young females with hair loss, they normally have iron deficiency, or thyroid issues is another big cause. So I want to make sure we're not missing anything that's, easily treatable that they could, get on supplement or treatment for and have improvement with their hair loss.
Okay, fantastic. So zinc, iron, vitamin D, thyroid function tests.
Mm-hmm.
Yeah, yeah. Okay, all right. And so with this, do you use some of the other vitamins, not Nutrafol, and I think there's some other that I'm blocking on.
Yeah, we have one that's made by the company that makes our PRP kits, and it's a good supplement. It's vitamin D, some collagen, some other herbal things that can help, been shown to help with hair loss. I do like Nutrafol as well. Nutrafol is a great product. It does have a little biotin in it, which you have to be careful with. We used to give everyone biotin, for the last 20 years who came in with hair loss. But there's a few recent papers that came out in the last few years that, one, show it's not beneficial for hair loss unless you have a biotin deficiency, which is pretty rare. And then it can also interact with some lab results. So it can interact with thyroid studies, thyroid labs, and troponin levels, which troponins are heart attack markers.
Right.
So there were a few case reports, of patients going in with chest pain and on high doses of biotin interferes with those lab results. And so it can be a little confusing to providers in the ER.
Okay. And what is the supplement concoction with vitamin D? What does that cost?
It depends. I think Nutrafol runs about $90 a bottle. And then the supplements that I carry in our clinic, they're about the same price. I normally include them, if you're buying a package of PRP, I just include them in that package. So most patients get them included with their PRP package. Okay.
Okay. All right. So it's important to get the basic lab work done, good medical evaluation, and then go from there. So it's actually quite detailed. I mean, there's a lot that goes into it.
Yeah, yeah.
Right.
And like I said, it's a complicated issue. For most patients, it's not just hormones or genetics. It's multiple things. It's thyroid, it's iron, stress plays a big role in hair loss as well. So most patients have two or three of those issues going on at once. So if you're not addressing all those issues, you're not going to get very far with hair loss.
Okay, good. And I imagine there's probably more of the stress during COVID. I mean,
yeah, absolutely. We've seen a lot of people with stress-induced hair loss. And then there was a recent article that came out, patients who've recovered from COVID, about 65% of those patients who've recovered have persistent and long-lasting hair loss after recovering from COVID. So not only does that stress of being sick cause some hair loss, it seems like just recovering or having COVID in general leads to long-standing hair loss.
Yeah, so most likely they'll recover, right? I mean, COVID's only been around not even 6 months, and so they'd get over it.
You would think after about 9 months is typically when you can start to rebound from that stress-induced hair loss. So maybe that's going to start to recover as we get a little further away from, the spikes in COVID.
Right. So we have a question from Anita on supplement regimen for postpartum hair loss.
Yeah, that one can be a little tricky. I like Nutrafol for that, or one of the other nutraceuticals or hairceutical supplements, like Viviscal, Nutrafol. But it's also an important time to make sure that you're seeing your doctor, getting some labs, and making sure you're not iron deficient or vitamin D deficient, because especially postpartum, that can happen. If you have a lot of blood loss during pregnancy, things cause a little bit of that stress-induced hair loss, and that tends to recover over a few months.
Okay. What is the difference between Viviscal and Nutrafol?
Really, one of the main differences is that Viviscal, they're slightly different formulations, but in the grand scheme of things, pretty similar. I believe Viviscal does not have biotin, and the Eclipse version of the Nutrafol doesn't have biotin either. Is that for most young patients, biotin's not too big of an issue because you're not worried about, them having a heart attack anytime soon. But especially older patients, you got to be a little bit more careful with high doses of biotin.
Okay. All right. Super. I think we did a lot of work on here. Thank you. That's fantastic. And what percentage of your patients are you seeing men versus women for the hair issues?
For hair issues, it's probably pretty close to 50-50.
Okay.
Like I said, men tend to be more that genetics and hormone driven hair loss, and then females tend to be more iron deficiency and stress. So it's a pretty even split. It definitely starts to bother both patients pretty early. So I have a lot of young patients who come in their late 20s, early 30s, from both sexes with concerns of hair loss.
Yeah. So somebody's asking, are biotin shampoos a gimmick?
I mean, there's not a lot of good data to say either way how well they work. I think there are better options if you're looking for a shampoo to help with hair loss. I think Ketoconazole or Nizoral will probably do a little better for you. Like I said, we don't have a lot of data that biotin improves hair growth at this point, so I'd say it's probably not worth spending a lot of money on a biotin shampoo.
Okay, cool. All right, very good. Thank you for that. All right, now let's, I don't see any other questions on hair, so we'll move on. That was fantastic. Now, eyes in men. What do you, I think I need all some here. All right, go over that, and what are the differences between, men and women?
Yeah, so around the eyes, the biggest difference between men and women tend to get their crow's feet that are more lateral or a little superior, meaning they kind of fan up a little bit. Guys tend to fan down.
Yeah.
So it can be a little tricky in males because a lot of times you'll use Botox to help correct those crow's feet. And some guys, you're not going to be able to get rid of all their crow's feet with Botox because you have a muscle that affects your smile, pulls the corner of your mouth up, that runs right along here. So if you're injecting too inferior to try to chase those crow's feet, you're going to run into problems with making their smile a little crooked. So it's always the biggest thing. And that changes where you inject a little bit. The other issue that you don't want to run
Where
into,
do you inject with the streaks down? Where do you inject?
so you try to stay pretty close to the orbital rim, and I probably don't have a lot right now, but mostly inferior. Where women, you're a little higher up.
Higher, okay.
Yeah, so it's a little lower in guys.
Okay.
And that's really the difference. The other thing, I'm sorry, go ahead.
And what about the excessive eyelid droop? What can you do for that?
Eye droop is always hard because guys, as you can tell, have a little more flatter brow. So in women, sometimes you can get away with doing a little bit of brow lift with Botox and relaxing some of the muscles kind of in the center part of the forehead and on the lateral tail of the eyebrow, and that causes a little bit of lift. With guys, that looks very unnatural. And so when you get a little bit of lift in guys and you raise their eyebrow, they're not going to like it.
Yeah.
So when you have a real heavy brow in a male patient, really not a lot that you can do with non-surgical options. And it's more of a surgical option. And then you have to be really careful when you're treating their forehead lines, because if you paralyze them too much up here, that's going to make their eye feel a little even heavier, and they're not going to like you for 3 months after that. So.
Okay. So a lot of nuances there. And then you send them to an oculoplastics.
Yeah.
They have a lot of drooping.
If they need an upper eyelid surgery or lower eyelid surgery, I just send them to an oculoplastic surgeon here in town and have them take care of it. Yeah. And it's a pretty easy procedure, fairly quick recovery, so it's not too bad.
No, not too bad. Okay. Fantastic. Who do you use?
I actually have been sending a lot of patients over to Dr. Leslie Pfeiffer, who just joined recently. She's over at Key Whitman off 75. So I send a lot of patients over there, and they tend to do a really good job.
Okay, good. Well, it looks like she's joined the call as well. So hello, Dr. Leslie Pfeiffer. Good. All right. We're going to move on to the jawline. So what are the issues with jawline in men?
Really, the biggest one is jaw definition. Like we were talking about, a lot of guys will kind of lose the definition of their jawline as you get to the posterior part of the jaw, and you don't have that sharp kind of border like a lot of young guys will have. And so see a lot of patients coming in wanting a more defined jaw or a little bit wider chin. And so I've been doing a lot of jawline fillers, which you just take a cannula, which is like a little kind of hollow needle, and you can run a little bit of a really thick filler along that bone to reshape the jawline, add a little bit more structure to the lower jaw.
Okay.
Yeah. So
and you do that on both sides. And which filler do you use for that?
So I use something heavy, either Voluma or Restylane Lift, because you want something that's going to have some structure and have some lift. Okay. And so you actually inject it pretty deep in this area. You want to try to get it against the bone. And that tends to last a good year to 2 years. And so it lasts quite a while.
Okay. And how many times do you treat them to get the effect? Is it a one-time shot?
Normally it's one time. You may have to come back and do a little adjustment, but a lot of time you just do it all in one setting.
Okay. And both sides?
Yeah. So it's not too uncomfortable. With the cannula, you just numb a little entry point right here and right here. And then you enter that cannula underneath the skin, and you can actually pass that underneath the skin. So from this one point, I can inject the whole jawline and chin without having to make a bunch of needle points or needle sticks. So it really minimizes bruising, minimizes downtime a little bit.
Yeah. Yeah.
So that's a great
Infusion one
option.
time, and it lasts
Yeah,
a couple of years, like you said. Yeah, perfect. And then
yeah. And
what about the double chin? I imagine you're doing a lot of the.
yeah, that's another big problem area for especially male patients. They get a little bit of extra tissue underneath the chin area, and then that makes them look like they're holding a little bit more weight. So, two options that are available now. You can do Kybella, which is actually an injectable medication, and what that medication does is it makes your body dissolve that fat. The downside with Kybella is that you get a little swollen, and that swelling can last about a week or so. So a lot of patients will have what we call like a bullfrog neck because this area will swell up a little bit for the first few days. And then over about 6 weeks, your body kind of takes care of that destroyed fat. And so results can take a while with it.
Okay.
Yeah.
And how often do you do that?
So normally it's a one-time treatment. You have to bring them in a few times. So I normally bring in patients like every 4 to 6 weeks and do 2 or 3 up front. And then once you get to a patient to a good spot, those results will potentially last, 4 or 5 years, as long as they're maintaining their weight, kind of taking care of themselves. Those are pretty long lasting results because your body's not going to rebuild that fatty tissue in that area very quickly.
Okay. All right. And how painful is this? I've heard variable commentary on that. And what do you do for preventing the pain?
What I do is just topical numbing, like we do for fillers. So it's just a lidocaine cream that we apply to this area. Let it set for about 30 minutes. There's a little bit of discomfort with Kybella. And what happens is when you inject that medication, you get a little burning sensation. That's always the harder part to minimize. So we do ice packs, things like that after treatment to help minimize that. But there's a little bit of discomfort up front, and then you get that swelling. And the swelling's not painful, it's just that initial burn from the injection.
Okay.
Yeah.
So filler and Kybella. Anything else for the jawline?
You can do Coolsculpting, our other non-invasive body contouring devices that have a chin piece. So Coolsculpting has a smaller piece that you can connect underneath the chin, and that freezes some of that fatty tissue, and then your body absorbs that fatty tissue over time. There's a little bit of swelling and sometimes a mild bruising or redness afterwards, but that resolves fairly quickly. And that works a little better for patients who have a little more bulk there. So if they have a lot of fatty tissue, they may not get where they want to be with Kybella alone. So we'll often have them do a little Coolsculpting first, kind of debulk that fatty tissue. And then you can come back and define their jaw a little bit better with Kybella after you've kind of debulked majority of that fatty tissue.
Okay. So what about diet and exercise? Where do you put that?
I mean, that should always be high on any patient's priority, especially when they're considering body contouring. Body contouring is not really an excuse or a replacement for diet and exercise. It's to help you get where you want to be. A lot of people, the ideal body sculpting patient is someone who has been on a good diet, been on a good exercise regimen, and just have some stubborn areas that they can't get rid of. And that's where Coolsculpting or other fat removal devices have their place. It's not for the patient who just doesn't want to exercise or doesn't want to diet and they just want to get rid of their fat. It doesn't quite work that way. So it takes a little bit of, effort on the patient's part as well.
Right. So do you have some patients who've had gastric bypass and so on that come to you? They've got a lot of extra tissue and some resistant area. Do you see those patients?
Not often. We will sometimes for the fat that you'll get underneath your arm if you have a little extra tissue there. But a lot of those patients had so much extra weight before they had their bypass, or if they did a band or anything like that, they have more excess tissue. And you can't really do Coolsculpting on excess tissue, that's more of a surgical, you know, tummy tuck, things like that to help with those problems.
Right.
So more what we see are the patients, like I was talking about, who have been on a pretty good exercise regimen. You know, as you get in your later 30s, you just get a few stubborn spots that don't really go away with diet and exercise. Those are more the patients that we see than the patients who've had gastric or bypass, things like that.
Right. Right. And what kind of diet do you prescribe to people to, you know, to aesthetically look better?
Well, it depends on what their goal is. A lot of patients will ask for like acne, if there's a diet that works better for that. There's been a few articles that have come out recently that low glycemic index diets are most beneficial for acne and keeping a clear skin complexion. So that's what I normally recommend to my patients. So really a low glycemic index diet is just a lot of fruits, a lot of vegetables, things that aren't going to spike your blood sugar. And so that can help.
Right. So low glycemic, that's Glycemic. So some things that's not going to really raise your sugar and your insulin level.
Yeah. So like skim milk or things like that can help.
Yeah. Yeah. And less ice cream and
yeah.
cookies and
dry food and cookies. Yeah. A little more
yeah.
fruits and vegetables. I mean, that's going to just make them healthy overall in general, which is always your goal. The healthier you are, the better your skin's going to be.
Yeah, and in the fruits, you've got to watch out for, you know, bananas and grapes because they're actually pretty high in, they got a high glycemic index. Watermelon as well, where it's be fine. And what I advocate is less carbs after 5 or, you know, 7 at night. You know, that helps your sleep as well.
Yeah.
So fantastic. What about you mentioned the arms earlier. There's probably a lot you can do for the arms.
Well, you have kind of the gold standard is still surgical intervention. So you can do a little arm lift there. And we normally send that to plastic surgeons. You can do Coolsculpting to the upper arms, especially if it's just more fatty tissue. You can do a little cool to the upper arms. Or now there's also cool toning and other like M-Sculpt, which are electromagnetic devices that contract the muscles.
Right.
And them contract the muscles at high rates of frequency. They say it's about doing 20,000 squats or 20,000 curls in a 30-minute session. So it's a lot of muscle contraction. It's a little uncomfortable, but not terrible. And that can help kind of tone those muscles and help dissolve some of that fat as well. So that's a good option for just toning when patients don't have a lot of just fatty tissue.
So you actually get muscle definition with that?
You do. Yeah. So M-Sculpt has some studies where they look at MRI of mostly the abdominal muscles, and they've shown a little bit of increased density of the muscle mass.
Okay.
And some shrinkage of that fatty tissue over the muscles. So.
Okay. Okay. Yeah. Fantastic. All right. That's so you've seen there's MRI evidence the muscle is going to get bigger.
Yeah. Yeah. There's a few studies. I think they were mostly sponsored by M-Sculpt, but pretty validated studies that show you do have some muscle improvement, muscle mass improvement doing M-Sculpt or cool toning or some of these other devices.
Okay, fantastic, fantastic. Wow, you've covered a lot from hair to eyes to jaws to you know, body contouring. I'm sure there's some things that we missed. I know we talked the other day. Was there any other area that we wanted to cover? Because I've got a full page of notes here.
I think we've covered most of them at this point.
Covered all. Okay. Yeah.
We've covered
awesome.
Well,
yeah. Listen, it was great having you on and sharing all this great information. So how do people come in to see you? What's your website?
So it's Dallas Assoc, derm.com. So it's Dallas Associated Dermatology is our practice, and they can just request an appointment online or call our central office and then get a scheduled appointment with me.
Okay. And your offices are where, generally?
So I practice out of our North Dallas office and then our Irving, Las Colinas office.
Okay.
And then we also have a Plano office and a McKinney office as well.
Yeah. Fantastic.
Yeah.
All right, Brandon. Thank you so much for your time. That was great information. Good stuff.
You're welcome. Thanks for having
me. Yeah, our pleasure. Hopefully we'll do it again and meet in person when COVID is over.
Yeah, sounds good.
Okay. All right, pal. Take care.
All right, bye.
Bye, everyone. Thank you.